What exactly was the treatment duration? How long were they assessed for? And when did we start seeing positive findings in patients?
Right. So as we would expect with this mechanism of action, so we evaluated him for 1 year. That's sort of a standard safety study, but we also did not expect prompt response, as you might expect from the mechanism, because it would requires some interaction with the RNA, and it's a splicing change that occurs. So by the time you make the splicing change, and then the protein is then produced, and then it's a structural protein, so it has to be reincorporated into a semi-crystalline kind of structure, which we don't understand the dynamics of that turnover. So it could be weeks, it could be months, could be longer. But what we found is that the visual acuity improvements and the FST improvements we started to see improvements within a few months, and by 6 months we saw the maximum improvement. So it's sort of on the time scale that we thought we might see something, but again, this study wasn't powered for efficacy. It was really just a safety exploration.
But nonetheless, it is very interesting, especially in consideration of the fact that there are so limited therapy options right now. And this is sort of foundational work for understanding what should be the expectation, right?
Correct. And, the improvements that we saw in the outperformers were so startling that it's clear that this was not just a placebo effect or some sort of new discovery of a previous area of visual function.
I see you guys are already on to phase 2 and 3 assessments. What are some of the goals that we're seeking out there?
So what we're looking for in the phase 3 is a larger cohort. We are looking at a slightly older population. So we allowed down to age 6 in the phase 1, but we're only allowing down to age 8 in the phase 3. So a little older because we're hedging because of the cataract. We're also looking at patients that have, in general, slightly better visual acuities. Patients were allowed to be light perception in this particular study, and even some of those patients improved. But we're really looking at patients who are better than light perception for the phase 3 study going forward. And we're targeting around 30 to 35 subjects, and doing a masked, randomized structure with some slight changes in dosing to look at whether that makes any difference. We really have lowered the dose from the phase 1 because of the concerns about the cataract and macular edema and retinal thinning. And so I think there was no evidence, by the way, that there was a dose response that indicated that the higher dose had any benefit. Therefore, we've gone to the lower dose for the phase 3.